Unlocking Your Transformation. Janet will provide us insights on expertise behind weight loss surgery choices. Go ahead, Janet.
Janet here from the Obesity Prevention Center. Today we are going to explore 4 expert weight loss surgery options. In the United States and worldwide, the reason why weight loss surgery is on the rise is because obesity is a rising issue that poses serious health threats. As this condition continues to influence a significant portion of the population, understanding its causes and implications becomes increasingly vital. Often, obesity is linked to a variety of health issues, including diabetes, heart disease, and certain types of cancer. Despite numerous attempts to control weight through dieting, physical exercise, and medication, some individuals find these weight loss methodologies ineffective. In these cases, they may turn to weight loss and bariatric surgery as a solution. This piece explores the factors influencing this shift from non-surgical weight loss methods to surgical solutions, the range of available surgical options, their associated risks and complications, and what life might look like post-surgery. Understanding obesity. Obesity is a chronic health condition characterized by an excessive amount of body fat. It's typically determined using body mass index, BMI, which is a measure of weight relative to height. An individual with a BMI of 30 or higher is considered to be obese according to this scale. Understanding the causes of obesity can be complex as it is often the result of a combination of factors. These can include genetics, lifestyle habits, environmental factors, and sometimes underlying medical conditions. For instance, consuming high-calorie diets without sufficient physical activity can lead to weight gain, and if this trend persists over time, it can lead to obesity. Alternatively, certain genetic factors can influence metabolism and fat storage, thereby predisposing some individuals to obesity despite relatively normal food intake. Obesity impact on health. The health impacts of obesity are numerous and wide-ranging. It increases the risk of various physical ailments, such as heart disease, high blood pressure, type 2 diabetes, and certain cancers. Obesity can also lead to problems associated with mobility and physical functionality, impacting overall quality of life. Apart from physical health implications, obesity is also associated with several psychological conditions. This includes issues like depression, anxiety disorders, body dysmorphia, and lower self-esteem. Therefore, obesity is a multifaceted issue that necessitates comprehensive interventions. Your guide to weight loss surgery options. Reaching and maintaining a healthy weight can be a real struggle for some people. If you try diet and exercise but haven't seen the scales shift, your healthcare provider might suggest considering weight loss surgeries for those struggling with obesity and related health issues. These procedures, collectively known as bariatric surgery, modify the structure of the gastrointestinal tract, the stomach and digestive system, upending your body's physiological and metabolic processes. Let's take a look at some of the most common types. Gastric bypass surgery. In this procedure, a small pouch is created in the stomach and the small intestine is bypassed. This confines the amount of food you can eat, and because of the rerouted intestine, your body absorbs fewer calories. Gastric sleeve surgery, also referred to as a sleeve gastrectomy. This surgery takes away a large portion of the stomach, leaving behind a slender sleeve shape. As a result, the amount of food your stomach can hold is reduced, making you feel satisfied earlier. Adjustable gastric band. This method employs a band to form a small pouch in the upper section of the stomach. This modification reduces the quantity of food you're able to consume. Biliopancreatic diversion with duodenal switch. This complex surgery shrinks the stomach's size while also bypassing part of the small intestine, leading to substantial weight loss. Each form of bariatric surgery comes with its own advantages and potential risks, some of which can be quite serious. That's why it's crucial to consult with healthcare professionals, including a bariatric surgeon, to determine the most suitable method given your health situation and weight loss objectives. While these surgeries can be an effective weapon in overcoming obesity and related health complications, remember that the surgery itself isn't the only answer. It must be complemented by a lifelong commitment to healthy lifestyle changes to sustain weight loss and enhance your well-being. Non-surgical weight loss methods. Alternative non-surgical weight loss methods. Of course, surgery may not be the best fit for everyone. Many people can see notable weight loss and health benefits from non-surgical methods, which typically focus on lifestyle changes. For instance, adopting a healthy diet and regular physical activity are key factors in achieving weight loss. Consulting with dietitians or nutritionists provides tailored guidance in developing a nourishing and enjoyable eating plan that considers your individual nutritional needs and preferences. Physical exercise is another critical aspect. Routine and varied workouts burn calories, accelerating your metabolism whilst also strengthening heart health and overall fitness. Aim for at least 30 minutes of moderate intensity activity on most days of the week. It's never too late to begin. With time and consistency, these lifestyle adjustments can lead to significant positive shifts in your overall health and well-being, potentially avoiding the need for more invasive procedures. Weight loss medications. In addition to lifestyle changes, FDA-approved weight loss medications can be prescribed for individuals who are unable to lose weight through diet and exercise alone, especially those with medical conditions like obesity or type 2 diabetes. It's crucial to note that weight loss medications should always be used under the supervision of a healthcare professional to monitor for potential side effects and drug interactions. When to consider weight loss surgery, moving from non-surgical to surgical weight loss treatments is generally considered when these lifestyle modifications and medications are ineffective, or when obesity has led to serious health conditions like hypertension or cardiovascular disease. Specifically, weight loss surgery, also known as bariatric surgery, is usually recommended for adults with a body mass index BMI of 40 or higher. It may also be considered for those with a BMI of 35 or higher if serious weight-related health problems are present, such as type 2 diabetes or hypertension. Prior to surgery, patients are typically required to undergo a rigorous pre-surgical screening process. This includes a series of tests and consultations with healthcare specialists aimed at identifying any potential risks and preparing the patient for the physical and emotional changes that come with this major surgery. Navigating the pros and cons. It is essential to be aware that weight loss surgery, like all significant procedures, carries both potential risks and gains. Consequently, it is vital to talk about these with your healthcare provider in depth. The advantages can range wildly, from substantial weight loss to improving or even resolving conditions linked to excess weight. Risks and complications of weight loss surgeries. Taking a closer look at the potential risks and complications of bariatric procedures. Weight loss surgeries, or bariatric surgeries as they're medically known, are growing in popularity in the fight against obesity. They often present a significant reduction in body weight and improvements in obesity-related health issues. However, just like any surgical procedure, bariatric surgeries carry inherent risks that future patients should be knowledgeable about before they take the leap. In addition, each type of weight loss surgery comes with its own set of specific risk factors. Inherent risks in any surgical procedure. The inherent risks that apply to any kind of surgical procedure include reactions to anesthesia, blood clots, infection at the surgical site, bleeding, and complications due to the patient's overall health condition at the time of surgery. These risks are usually minimized by thorough preoperative assessment and prompt postoperative care. However, complications do sometimes occur and can lead to prolonged recovery times, repeat surgery, or, in rare cases, death. Gastric bypass surgery risks. One of the most common weight loss surgeries is gastric bypass, where the stomach is divided into a small upper pouch and a larger lower remnant pouch, which reduces the amount of food the stomach can hold. Potential complications specific to this process include dumping syndrome, where undigested contents pass too quickly into the small intestine, gastric leaks, bowel obstruction, and malnutrition due to decreased absorption of vitamins and minerals. Laparoscopic adjustable gastric banding, LAGB, risks. A less invasive procedure, LAGB involves placing a band around the upper part of the stomach to create a small pouch with a narrow opening into the rest of the stomach. Risks associated with LAGB include band erosion, band slippage leading to pouch enlargement, esophageal dilatation or reflux, and mechanical failure. Vertical sleeve gastrectomy risks. Another option is the vertical sleeve gastrectomy, where around 80% of the stomach is removed, leaving a narrow vertical sleeve or tube that is about the size of a banana. Risks here include leak from the staple line, development of hernias, and similar to the gastric bypass, potential for malnutrition, and vitamin deficiencies. Biliopancreatic diversion with a duodenal switch, BPD/DS risks. In more complex cases, especially for super obese patients, a BPD/DS may be recommended. This procedure carries higher risks, including greater potential for malnutrition and vitamin deficiency, intestinal irritation, foul-smelling gas and bowel movements, and potential for higher mortality rate due to the complexity of the procedure. Before going under the knife for weight loss surgery, a careful examination of the benefits versus the potential risks and complications is paramount. Patients are encouraged to engage their surgeons in thorough conversations to understand the implications of each surgical option. This way, an informed decision can be made. Factors such as an individual's overall health, personal weight loss objectives, and a resolve to adopt the long-term lifestyle changes should be considered in choosing the most fitting weight loss surgical procedure. Life after weight loss surgery. The journey to recovery following a weight loss surgery varies with each patient and is determined by the specific surgery performed. For instance, the average hospital stay for those who undergo a gastric bypass is usually around 2 to 3 days, with a complete recovery happening after about 3 to 5 weeks. On the other hand, patients who choose gastric banding or sleeve gastrectomy usually have a shorter hospital stay, a generally faster recovery period, and less complications. Also of significant note is the dietary restrictions implemented immediately following the surgery. Typically, patients' diets comprise of clear liquids and pureed foods only. However, as their bodies gradually adapt to the surgical alteration, normal foods are slowly reintroduced into the diet. Lifestyle changes post-surgery. The journey to sustained weight loss after surgery is neither automatic nor effortless and necessitates significant lifestyle changes. Foremost, regular exercise will be crucial in keeping the weight off. Most experts recommend a combination of both strength training and cardiovascular workouts for optimum results. In addition, dietary habits must change. The new, smaller stomach size requires smaller, more frequent meals. Patients must work closely with a dietitian to ensure they are getting enough protein and other essential nutrients, whilst avoiding foods that can cause discomfort or dumping syndrome. Also, it is recommended to limit intake of sugary and fatty foods. Emotional health after weight loss surgery. In many cases, weight loss surgery ultimately leads to overall enhancement of quality of life, bringing improvements in physical health issues like diabetes or heart disease. However, it's important to note that emotional health can be affected post-surgery. It can be a huge step for individuals as they experience drastic weight loss and body changes. Some might experience a boost in self-esteem and mood, while others may face challenges including anxiety, depression, or struggles with self-image. Some patients find themselves dealing with a type of identity crisis as they get used to their new body and the reactions of others. It is thus highly advised that patients have access to support groups and mental health professionals to navigate these emotional changes and challenges. Another key point is that patients may have to grapple with loose skin after dramatic weight loss. Many opt for cosmetic surgery to remove excess skin, though the decision is entirely personal and depends on how the individual feels about their body post-surgery. Long-term outlook. In the long term, patients can expect significant weight loss within the first 6 months to a year after surgery. After this period, weight loss usually continues at a slower pace. The amount of weight loss and how fast it occurs, however, varies from one person to another. Above all, it's critical to understand that weight loss surgery is a tool to aid in weight loss, not a magical cure. It requires lifelong habits of healthy eating and regular physical activity to sustain the weight loss. It involves commitment and dedication to a healthier lifestyle. While the journey may be challenging and fraught with both physical and emotional obstacles, weight loss surgery can serve as a transformative experience that positively alters the course of one's life. Nevertheless, it's essential to remember that surgery should not be viewed as an easy way out, but rather as a tool to assist in the weight loss journey. It requires a steadfast commitment to lifestyle changes following the surgery and a dedication to overall health and well-being. Knowing the risks and benefits associated with each surgery type, as well as understanding the path to recovery, can aid in making an informed decision when considering weight loss surgery.
Another great topic for today. Thank you for being with me and Janet. To all our viewers, please don't forget to like, share, and subscribe to this channel. Our newsletter is also packed with special offers and exclusive content directly to your inbox. See you next time.